A follow-up now to a story you first saw on 22 News at 11 last night. Baystate Franklin Medical Center nurses could be going on their second strike in 2 years over contract negotiations. 22 News reporter David McKay spoke with the president of Baystate Franklin Medical Center today to see how it would affect the hospital and how residents feel about this possible walkout.
That's right. It wouldn't be the first time nurses from Baystate Medical Center went on strike, but this time the strike could last a little bit longer and be dealt with differently. The Massachusetts Nurses Association and Baystate Franklin Medical Center have been in contract negotiations for nearly 2 years, disagreeing mainly on overtime and sick pay. On Tuesday, nurses voted to approve a 3-day strike if negotiations fail again.
The nurses I know and spoken to about these kinds of things, they're incredibly overworked. They have too many people per nurse.
President of Baystate Franklin Medical Center, Chuck Gijanto, says they're already in contingency planning, but it's a bit different from last year when there was only a 1-day strike and they were able to bring in help for services from the Baystate system.
This year, if there is a strike, it'll be a 3-day strike, and so it will change our planning somewhat, including perhaps needing some outside agency help to help cover the hospital in the case of a strike.
Gijanto says that this potential strike will not affect services and wants to reassure the community that they will still get the care they need. Residents 22 News spoke with today said the ongoing tensions make them uneasy.
You know, it does have some reason to cause some worry amongst, the locals here. I mean, 3 days is a long time, and, it could seriously cut into someone's medical needs if they're not going to be there to take care of them.
A week from today will be the 40th contract negotiation session from 9 a.m. to 1 p.m. at the First Congregational Church here in Greenfield. Live from the Franklin County Bureau, David McKay, 22 News.